Region up, that is the location of first point, that is called 77.05, or first weight. We can correlate this point with the gallbladder 39. Then we are going to tune up, and to tune up we are getting 77.06 and the 77.07, all the 3 points available in the gallbladder meridian. The third point is gallbladder 35, or the medical emergency point. How to locate the point exactly? So look at this structure here. There are two bones in the leg. Inner bone, that is called tibia. One is the outer thin bone, that is called fibula. So gallbladder meridian is found on the front or the anterior border of fibula. Exactly, it's passing through the anterior border of fibula like this. This is the gallbladder meridian. First point from the lateral malleolus, there is gall 77.05 or gallbladder 39, which is 3 tune-up. The second point 2 tune-up and the third point 2 tune-up. So second point 77.06 and the third point 77.07. 77.07, or the uppermost point, is G cleft point, or the medical emergency point. That is gallbladder 35. One more G cleft point located there, gallbladder 36. Gallbladder 35 is the G cleft point of gallbladder. When you are stimulating all the 3 points together, what will happen? There will be very great reaction will happen in the brain. Great reaction happening in the throat. So there is a great reaction will be happening on the brain, definitely on the face, and even on the breast. Okay, I will explain how the breast. So look at here. So when we are stimulating gallbladder, it will directly activate the liver, and liver is the channel activated. Why? There's 3 weights, and liver is the channel who supply this central line. That's why 3 weights are very good for throat, very good for breast, very good for face, and very good for the brain. And we are using 3 weights to calm down the hyperactivity. We are using 3 weights to control the liver hyperactivity. We are using 3 weights in the hyperactivity. If the person is having high BP, definitely we can use. Person is having hyperthyroid, definitely we can use. The wind attack, definitely we can use 3 weights. Tumor in the brain, we can use. The breast lump, we can use. But we cannot use if the low BP. We cannot use if the something low. We are calming down the liver. If we are using 3 weights in the low BP, reduce the BP further down and person might feel discomfort. So it's not recommended. Person is suffering with the low blood pressure. First I will do the demonstration, then I will discuss more about this. How we are putting 3 weights. Many persons are not able to join. My feet here. You can see this is the lateral malleolus. The midpoint of the lateral malleolus. I will count 3 tung. This will be my first one. Up. I will see the bone. Okay, this is the bone. So the front border of the bone is the point number 1. So how to put the needle? We can put the needle this way in the upward direction. Point number 1, 77.05. Here we are going to tune up. Again 2 tune. Uppermost point will be left point. So this is the uppermost point. One point in the middle of these two. Excellent point to count down the hyperactivity of the excellent point for brain, face, throat and the breast. Calm down the hyperactivity and it will expel unwanted energies from there. So first weight, second weight, third weight, 77.05, 06, 07, or we can tell this is the gallbladder 39 and this one is the gallbladder 35. All the 3 points are located on the anterior border of this fibula bone because the gallbladder meridian is running through the anterior border of fibula. We are not using this point for liver cirrhosis. Most of the time, see, we also using imagination concept. So most of the time we are using this point from head to chest, starting from the head. Brain tumor, anything like some person got accident. After the accident, there is some blood clot inside. There is unwanted growth, high pressure in the brain, high pressure in the eyes, like the glaucoma. Here. Look at this small video. In the gallbladder meridian, if I am going 5 tune up, that is the location of gallbladder 37. So ultimately, from here we have 3 points. Gallbladder 39, gallbladder 37, gallbladder 35. Gallbladder 37 is very good point for the eyes. Very good point. I will tell you why. Good point for the eye, right? This is the location of gallbladder 37 here, which is 5 tune up. Let's start from the 77.05 or the first weight or the gallbladder 39. All the 3 points we are using for painful breast, lump or cyst in the breast, any problem of the thyroid like the thyroid enlargement or the hyperthyroid. Definitely we are not going to use in a hypo condition like the hypothyroid. And all the 3 points we are using for a spleen problem. Spleen, there is a spleen enlargement. Use all the 3 points. So when we talk about the first weight for the gallbladder 39, gallbladder 39 77.05 or the first weight is very good point for hyperthyroidism and tonsillitis, means any types of inflammation in throat region. The imagination, if we do, this is the head region, this is the throat area, this is the chest area, knee will be the navel area, and thigh will be the abdomen. This imagination, this ankle area is representing the throat area. 77.05 is very good point for that. 77.05 or the gallbladder 39 or the first weight. Very good for exophthalmos. What is exophthalmos? Exophthalmos is the condition eyes are bulging out. They are bulging out. It's very common in hyperthyroid. I am telling you, we are using it in the hyper condition. So you, how the patient of exophthalmos looking like. Look at this image. See, eyes are bulging out. This is because of the high secretion of the thyroid. Alertness. Thalamus, eyes are coming out. I will repeat, we are not using this point in low BP. Some other point. Second, suppose someone has got the attack, stroke, or deviation of the eyes and mouth. Definitely we want to extend it. The excessive condition, we will immediately use 77.05. The severe migraine headache, we know migraine headache is more connected to the gallbladder meridian. We will expel the unwanted energy out. Meningitis is the condition when there is a brain problem, inflammation of the brain, inflammation of the layering of the brain, meninges of the brain, which is happening in the very, very high fever. Or the tumor in the brain, cranial tumor, and even the liver disease, right? Like someone asked whether we can use in the liver. But for the liver, we are having multiple other points. But okay, if you want, you can use it. So here I have written too many diseases which are connected to the brain. And here I have written disease connected to the throat region. Even if there is enlargement of the spleen, it's common when the person is suffering with the malaria. After the malaria, there is enlargement of the spleen. Using on the other side, right side. Tell why the spleen is enlarging in the malaria. You have idea? Why there is enlargement of the spleen in malaria? We know spleen is a small structure in the left side. Hidden on the back side. It's not visible. It's not palpable. When it's enlarging, we can feel here. Even sometimes it becomes very bigger coming to the area. Then we can feel the hard structure. Why the spleen is enlarging? In the malaria, what's happening? Number one, spleen is the graveyard of RBC, Kabristan, RBC ka Kabristan. There is lots of breakdown of the red blood cells. So dead bodies are buried in the spleen. So it's enlarging. Spleen is lymphatic organ, doing lots of lymphatic cleansing, definitely having many WBC, fight against the bacteria. In the response of immune system, it's enlarging. When it's enlarging, after we are becoming okay, malaria is cured, but spleen is still enlarged. Take month, 2 months, and more than that, shrinked again. Some cases when it is not shrinking, then doctors are cutting the spleen. Spleenectomy. They are cutting and removing the certain part of the spleen. But we can do the treatment by these points. Now No, it will not be painful. Large spleen is not at all painful. Just enlarged. Person is not having the local area.
इसमें डाल दो आंटी
क्या हाँ ऊपर डाल
Let's talk about the 77.06. 77.06 or gallbladder 39. Sorry, gallbladder 37. Second point, or called second weight. All the indication are same like 77.05, like it's good for. Reason means hyper condition of the thyroid and the tonsillitis. Even it's good for brain, so good for cranial tumor, meningitis, migraine. There is a facial paralysis, attack of wind stroke, deviation of the eye and mouth, eyes are bulging out, exophthalmos, all the condition, including the spleen. Same for the second weight. It is a more effective point for eyes. Why? So this explanation is given in the TCM. In the TCM, it's written whenever any meridian is suffering, so take the Leo connecting point
निशा ये रुमाल जैसा कपड़ा पकड़ाइए
of couple meridian. Example, if liver is suffering, so person is having eye problem, like the exophthalmos, like the glaucoma, which is the high pressure in the eyes, like redness of eyes. Liver is suffering. Take the couple means gallbladder, Leo connecting point of gallbladder. Gallbladder 37. One more example. We know we can divide the body in three parts. Upper part, middle part and the lower part. Swelling in the upper part is due to lungs. Swelling in the middle part due to spleen. And the swelling in the lower part is due to kidney. Even heart and liver might be responsible, but these are most responsible. Swelling in the upper part is because of the lungs, swelling in the middle part because of the spleen, and swelling in the lower part because of the kidney. Okay, let's talk about the upper part because we know it's a very common puffiness around the eyes. Puffiness around. It's a very common. As soon as we see the puffy eyes, oh, declare lungs are in disharmony. This image. Very common, you might have seen, like this puffiness below the eyes. Have you seen it? See, puffiness around the eyes. So, who is responsible? Which meridian is involved? Tell me. Which meridian is involved? Can you tell me? Lungs meridian is involved. Now, Redness around the eyes due to lung. Treat it. Purple means large intestine. The Leo connecting part of the large intestine. Li6. Li6, if you see the TCM book, it directly written that 6 is the good point for puffy eyes. Okay, but this is the explanation. Whenever any meridian is suffering, take the Leo point of couple meridian. Here, the 3-way second point is gallbladder 37. Connecting point of gallbladder meridian. When liver is suffering, we can take the Leo connecting point of the couple meridian. That's why it is one of the great points for eyes, exophthalmos, glaucoma, red eyes, conjunctivitis, all the hyper conditions of the eyes. Using for the deeper problem of the eye. Problem eyes we are using. All other indications seem like 77.05. Let's talk about the 77.07 or the G cleft point, gallbladder 35. When we talk about the 2G cleft point, gallbladder meridian. Look at the legs. From the lateral malleolus, if I am going 7 junab, there are 2 G cleft point. One, because we know the gallbladder meridian is coming like this. So 1 G cleft point in the front of the bone, that is gallbladder 35, which is the G cleft point of gallbladder. On the back side of this bone, that is gallbladder 36, which is the G cleft point of EOV or the extraordinary vessels. Here we are stimulating entire area, or we can focus on the gallbladder 37, 35. Because it's a G cleft point, what can do? Concussion in the brain means some person got accident and there is a medical emergency of the brain. We can always use this point. So the meaning of concussion means injury of the brain. Traumatic injury of brain. Like some person fall down from the bike and got this injury. Let's see this image. You see this? This person fall down on some object and got concussion. This is the contusion, but there is a little difference between concussion. You can see this redness, right? Because of the accidental injury. This concussion is very dangerous. You know why? Person is if we are getting hit with some object, we are getting bleeding, external bleeding, it's good. But when there is internal bleeding, it might create very big problem. Concussion of the brain, we will be using 77.05. or the gallbladder 39, 35, or the medical emergency point, or the third weight, cerebral palsy, very advanced condition of the problem, and even the Bindestrom. Other point also we can use on the Bindestrom. And other all indication like same, like 77.05. So all the 3 points we are going to use for brain, for eyes, for any nerve problem of the face, like the trigeminal neuralgia, or for throat, but in all the hyper condition. Some person is suffering with the meningitis, or we can tell brain fever. After the brain fever, they are suffering with the meningitis, and it might be very dangerous because some person might lose their normal function, and even they might go mad. Taken 77.07, or the gallbladder 35, or the medical emergency point of the gallbladder meridian 27.07. But we have taken 77.01. Yesterday I told you this point in the tendon and very good for brain. 77.01. The third point, that is 77.09, tell you what is where is located. We will discuss 77.09 means stomach 38. Very near. It's available very nearby. Discussing short. 77.07, and the nearby point, that is stomach 38, and the 77.01. 3 points are very good for brain. To bring the focus. Breast. There is a fibrocystic breast, lump in the breast, cyst in the breast. Sometimes there is a painful breast period. You can always choose this point. I will tell you, actually it's not written, can't use in the low BP, but I will tell you one day, because one female was suffering with the lump in the breast, was very lean and thin, weight hardly 42 kg, 50 years female, lean and thin, 2 kg weight only, just half than me. Definitely she was having low BP, low hemoglobin.
एक दूसरा है ब्लू
Inserting this point, 77.0567. Immediately she start getting chest pain, giddiness type symptom. I recognize, okay, she was suffering the fibrocystic breast lump. I thought, let me stimulate this point. So if you want to stimulate this point for the person suffering with a low BP, okay, stand there. Point. Because I'm talking about the female, she was very lean, thin, weak, hemoglobin, low BP, and weakness. can't further increase more energy, right? After that, I have stimulated this point. For many male and female, if they are having hyper energy pattern, they were very happy. Effect of point, right? We can always use this point, a hyper condition. And definitely we can use it for liver. If the liver is very hyperactive, and because of the hyperactivity, liver person is having excessive anger, redness of the eyes and all, we can choose this point. The explanation of 77.05. Some we can do gua sha, yes, definitely. We can do gua sha, we can do acupressure, we can hit the point by various methods. We'll be moving to the next point. 77.08. Eight, 9, 10, 11, 12, all points are in the same line. So look at here. We can see this is the stomach 35. From here they are going 3 tune down, stomach 36. As per the TCM, stomach 36 is not to the bone, we have to go 1.5 tune, the stomach 36. For the master tune, we have to be very close to this bone. If you are going away from this bone, if there is other point, we will be discussing sometime. On the border of bone, there is another point. Away from the bone, there is another point. Right now we are talking about the stomach 36, but exactly on the border. That is called 77.08. We are going 4.5 tune down, tune 1.5 tune. Stomach 38, between stomach 36 or the stomach 38 is 4.5 tune. This is called 77.08, 77.09. Then we are coming 2.5 tune down, 2 tune, little more. Again 2.5 tune down, there is a 2 tune, again little more. In this way we have to look at 4 point here. 1, 4.5 tune down, 0.5 tune down, 2.5 tune down. Repeat. Number 1 point will be stomach 36, but close to the bone. Second point is stomach 38, close to the bone. Distance is 4.5 tune. Then 2.5 tune and the 2.5. 4 point. These 4 points are called 4 flower. Here we can treat from this 4 flower, treat entire alimentary canal. Starting from the stomach 35, we can treat the mouth. Till the stomach 36, we can treat the mouth, throat, and chest. Even stomach 38, we can treat the chest and shoulder area, then like esophagus, food, fat, stomach, and intestine. The last part of the intestine, like the rectum. So from your mouth till the rectum, entire alimentary canal can be treated with the help of 4 flowers. 1, 2, 3, 4. 77.08, 77.09, 77.0, 77.10, and 77.11. 8, 9, 10, and 11 4-point unit are called 4 flower, and they can treat mouth till rectum. Someone is suffering with the problem of the intestine. Choose lower 2 point. Suffering with the problem of the mouth, food bath, choose upper point. You want to treat entire alimentary canal, choose all the 4 points. Treating all the 4 points, they call 4 flowers. First point, 36. That is called 4 flower upper. It's called 4 flower upper. So these are 4 flower. Then we are going to the stomach 38. 5 tune down. 4 flower middle. We are going 2.5 tune down. And 2.5 tune down. Flower upper, 4 flower middle, is a 4 flower lower, called 4 flower append. 4 flower upper, 4 flower middle, 4 flower append, 4 flower lower, all the 4 points together are called 4 flowers. From stomach 36, we can treat the mouth, not only from stomach 36, from stomach 36 to the stomach 35, we can treat the mouth. Stomach 35 is the lips. Stomach 35 are the lips. We want to make your lip beautiful, stomach 35. We want to treat the dryness of the lips, white spot of the lips, leukoderma of the lips, stomach 35, right? Lips can be treated via stomach 35. Then the remaining part of the mouth treated by the stomach 36. 36 and stomach 38 can treat mouth till the stomach area. Mouth, food pipe, who is passing from the chest, stomach area, we can treat by these 2 points, mouth to stomach. After the stomach, there is intestine. Small intestine, large intestine, enteritis, any problem, IBS, disease, we can treat by these 2 points. So stomach 36, 5 tune down, stomach 38, 2.5 tune down, 2.5 tune down, 77.08, 77.09, 77.10, 11 is 2.52. Last point is very good for intestine, enteritis. Suppose I want to treat the intestine problem, I can take 1 point here. I can put 1 extra needle here. Between this area. Both are bilateral. On the left side. So suppose I want to treat the intestine, I will choose this point. I can take 1 more point, little up like the 1.5 tune up, because the distance in between these 2 points is 2.52. I told you 77.08, 77.09, 77.10, 1. Master told, okay, take 1 more point. Take 1 more point from here, which is 1.5 tune up. That is 77.12, which is helping point. Like both point good for intestine. All the 3 points we can put for intestine, enteritis. So 77.08, 09, 10, 11, and 12 for intestine. All the point on the border of bone. Border. So tell me, for the piles, which point is good? For the problem of the rectum piles, which point is good? Upper point or lower? Lower point. Good. Mouth. Which point is good? Mouth problem. Point, right? Yes, for dental problem, for mouth problem, upper point is good, right? Asthma, which point will be good? It's a very good for, because stomach meridian is passing. Stomach meridian is passing through the lungs as well as through the heart. So tell me, a person is suffering with the problem, which point is good? Good flow. 7.08 and 9. I told you mouth to stomach area. Okay, one person is suffering with asthma, which point is good? One person is suffering with a tumor in the mouth, which point is good? Tumor in the mouth or mouth cancer, which point is good? 27.08 and 9. 7.08 and 9 are good for mouth to. One person is suffering with the shoulder pain, which point is good? And we know stomach 38 is the magical point of shoulder pain. 27.08 and 9. Person is suffering with a tachycardia, high heartbeat. Which point is good? Wonder 77.08 and 9. Master Tung told if you do the bleeding on the stomach 38, it's very good for tachycardia. Why bleeding on the stomach 38 is good for tachycardia? Because starting from the mouth till the stomach, these areas controlled by 77.08 and 9. Bleed stomach 38, see the wonderful result in the tachycardia, in the high pulse rate. The person is suffering with the abdominal distension. Which point is good? Abdominal distension. Which point? $11, $12, all the 3 points, right? One person is suffering with the one person is suffering with the pain of which point is 1% is suffering problem of entire alimentary canal. Which point is whole alimentary all four flow, right? Or the full flow. Got it? So definitely four flower will be more effective in the left side, but we can use any side. We can, why I am telling any side, suppose someone is having tumor in the mouth, the left side, then you have to use it in the right side. Right or not? We are using point on the contralateral side. Okay, done for today. Tomorrow we'll start. You want to see the needling on the full flower? You stomach 36 and 38. It's same way. Okay. If anyone want, I will do tomorrow. No problem, right? For your books. Stomach 38 is very good for any problem happening mouth to stomach area, like any problem in the mouth, any problem in the heart, high heart rate. We can use stomach 38 bleeding. Stomach 38 bleeding, right? It is very good for this. Let's see all the points here. $77.08. We can see closer to the boom. And 4.52 down, 77.09. And 2.52 down and 2.52 down. 77.10 and 11. From the 11 we have taken 1.52 up. There is one extra point, that is 1.2, right? Clear now? All the points? tomorrow. In the session.